Many Americans suffer from chronic joint pain, and the issue is actually on the rise, and not just because the population is aging, but also because obesity rates have increased and weekend warriors are kind of overdoing it with injuries. Surgery can seem like an overwhelming option for most people, but there have been great strides in joint replacement surgery in recent years. Dr. J. Michael Wiater is here to tell us about them. Doctor, thank you so much for being with us.
Hi, thanks, Tina, for having me.
Doctor, let's start out with maybe some of those causes of the joint pain.
Well, there's a lot of things that can cause a joint to become painful, but the top two reasons would be a traumatic injury to the joint and arthritis. So a traumatic injury to the joint can occur at patients of any age, and it could involve the bone, which can be fractured, or it could be a soft tissue injury like a tendon, ligament, or cartilage tear. Arthritis is a very common cause of a painful joint, and patients at most risk for that are those in the elderly years. And what arthritis is a breakdown of the cartilage that normally covers the ends of the bone. That cartilage cushions the joint, and when it breaks down, the bone underneath becomes exposed and then can rub and grind together, which can cause the joint to become very painful.
And I know we're talking about joint replacement when we're talking about this. How do you know if you're a candidate for that?
Well, typically patients will have pain that's significant to the point that it keeps them awake at night and limits their activities during the day that they normally would like to do, and can also make it difficult to do their job. Typically, patients will, by the time they need a joint replacement, have failed the normal non-surgical treatment options, which would include medications, physical therapy, weight loss, activity modification, and maybe cortisone injections. When those things fail, then it's usually time to have the joint replaced.
And I know we were talking about there being so many advancements with these surgeries. What are some newer options that are available to people?
Well, there's a lot of options available that we can offer patients that weren't available even 5 years ago. So in shoulder surgery, we have available now the reverse total shoulder replacement, and that differs from the standard shoulder replacement in that the ball and socket are replaced with a metal ball and plastic socket, but they're put in reverse position. And that prosthesis is designed to treat patients who have not only arthritis, but severely torn rotator cuff tendons, and it allows patients to get range of motion back in the shoulder so that they can reach overhead, and it gives them function that they weren't able to have before surgery. In the hip replacement area, we're able to offer an anterior total hip replacement approach, and that's a muscle sparing approach that decreases the risk of the joint dislocating after surgery, which leads to a shortened recovery time. In the knee joint, we're able to take cartilage cells from the patient's knee, take them to the laboratory, culture them, and then during a second surgery, reimplant those cartilage cells as a graft to fill in arthritic defects and hopefully delay or even eliminate the need for a total knee replacement.
Well, I know since we're seeing that these replacements and the need for them is on the rise, I'm sure a lot of people have questions and want some more information. Is there a place we can go online for that?
Sure. Beaumont Health has put together a great website that I'd recommend patients take a look at, and that website is called jointpainrelief.org. That's jointpainrelief.org. And on that website is a lot of good information for patients. They can download treatment guides, and they can even take an online class to learn more about joint pain and the treatment options available.
Well, doctor, thank you so much for the information you've already given us.
Thanks, Tina.
Don't go anywhere. We'll be right back.